The topic of our today's discussion is cholera. Cholera definition. Cholera is an acute diarrheal illness caused by infection of the intestine with toxigenic bacterium Vibrio cholera serogroup O1 or O139. It causes severe watery diarrhea which can lead to dehydration and even death if untreated. It is caused by ingestion of food or water contaminated with the bacterium Vibrio cholera. Etiology means the causes of cholera. Cholera is caused by bacteria called Vibrio cholera. The disease's deadly effects are the result of the strong toxin known as CTX that is produced by these bacteria in small intestine. Contaminated water supplies are the primary source of cholera infection. Uncooked fruits, vegetables, and other foods can also contain the bacteria that cause cholera. Risk factors. Unclean conditions such as poor sanitation and contaminated water, low levels of stomach acid, sick household members, type O blood group, eating raw shellfish. Clinical presentation. What are the signs and symptoms of cholera? Most people remain asymptomatic, but the symptoms of cholera include profuse watery diarrhea, rice water diarrhea, vomiting, stomach pain, leg cramps, mild fever, sunken eyes and cheeks, decreased urinary output. This is a picture depiction of the symptoms of cholera, which include vomiting, low blood pressure, diarrhea, rapid weight loss, increased thirst, and loss of skin elasticity. Cholera diagnosis. Most causes of cholera are presumptively diagnosed based on clinical suspicion in patients who present with severe acute watery diarrhea. The diagnosis can be confirmed by isolation of Vibrio cholera from stool cultures performed on specific selective media. Rapid tests such as stool, dipsticks, or darkfield microscopy can support the diagnosis in settings where stool culture is not readily available. Stool culture. A definitive diagnosis of cholera is based on isolation of the organism from clinical samples, which also permits a determination of the antibiotic susceptibility profile. Once cultured, Vibrio cholera can be identified by biochemical tests. Serogroup and serotype can be assigned by testing with specific antibodies. Molecular and rapid tests. Several rapid antigen detection based tests are commercially available to diagnose cholera. These include immunochromatographic lateral flow devices like dipsticks such as crystal VC, which detect the presence of O1 or O139 antigen in rice water stool samples, and CHOLERA, which detects only the O1 antigen. Then the pharmacotherapy, which means the treatment for cholera. First treatment is the oral rehydration solution, also known as ORS. The dose is put 1 sachet of powder in 1 liter of water. Infants 1 liter over 24 hours. Children 1 liter over 8 to 24 hours, and adults drink freely 2 to 4 liters in 24 hours. Antibiotic therapy include for adults doxycycline 300 mg per oral single dose plus ciprofloxacin 1 gram per oral single dose, and in children doxycycline 4 to 6 mg per kg single dose plus ciprofloxacin 15 mg per kg twice a day for 3 days. So this is all about cholera.